Hi, welcome to the setup video for your DocVilla account. Now we're going to start by logging into the system. So to log into the system, you just go to the website, which is docvilla.com. Okay, and you click the provider login button. Now, once you click that button, you'll be redirected to the login page for the providers, where you'll enter the email ID and the password that you registered. And after that is created, it will ask you for a two-factor authentication code, which will receive it on the registered email. So you enter that code and you submit it, and you'll be into the DocVilla system. Now, the first view, if you're logging in as an owner provider, would be the prescriber role, which will have this window with no consoles and no patients. Contrary, what we're going to do first is that we're going to set up the account for your DocVilla EMR. So for that, you go to the prescriber, you change your role to become an account admin. Now, once you change the role, the window view changes and you'll be able to see the site information and the account information as well. Now, before we verify the information under the site, what we're going to do there is we're going to set up your payment profile with Stripe. Now, for that, you just click setup, you hit payment profile, and it will redirect you to a Stripe page where you'll be able to create an account with Stripe. Now, again, please be very sure that when you're setting up your Stripe account, you're choosing it to be set up as a company and not an individual. Because if you choose it as an individual, we would have to reset your Stripe from the back end, and then you'll have to do that steps all over. Again, if you're not sure how to proceed with your Stripe setup or your payment profile, please do not proceed with the steps of the payment profile. Just contact us on our support email, and then we'll be able to assist you further. Now, once that is done, you come back to the DocVilla EMR, where you just verify all the information under the location, which is that you're verifying the name, the phone, fax, the street address for the facility. If anything needs to be changed or is incorrect, you just make the changes, you save it, and the system will save it for you. Now, again, we do not recommend adding any of your staff members under the account admin information. We'll have a different section for them, which I will tell you in the further steps. Now, once your information for the facility is changed, and you verify that everything up here is correct, you then click setup and you go to account or user profile. Now, under the user profile would be your own information, which will be the name and the phone number for the particular person who has logged in currently to the system. Again, here, you can change your credentials to an MD, nurse practitioner, physician, clinician, whatever your credentials are respectively. And then you verify the email address, and then you can also change the security code receiving, whether you want it to be received on email or phone number. You can make that change, and then you just save that information. Now, again, under the account information, you'll again cross-check the phone, fax. You can then enter your tax ID as well here, and then you check the address for the facility again. And make sure that everything here is correct. Now, for all the changes that you do on this page, make sure to click Save or Update Account for the system to save that information for you. Now, after this is done, you go back to the account admin and you change your role then to become a site administrator. Now, once you're under the site administrator, this is again the information about the location of your facility. Now, under this, you'll verify that the current location and its respective information is correct. For example, for Hoboken location, I'm verifying that the phone, fax, the pharmacy contact number, the address is all correct with the facility NPI that I'll be putting it here. For that particular location, and I'll also be setting up the time zone according to myself. If it is something different than the Eastern time, you can change it to your respective time zone as well. Now, once that is done, you hit save and everything will be saved in the system for you. Now, location admins, administrators is the area where you can add your staff members, whether it will be an admin, it'll be other providers that are under you, or any other staff member that is working with you as well. So for that, you just click add new if you're adding them for the first time in the system. You'll just put in their name, last name. Now, the email address that you use for them should be their personal email address, which they will use to log into the system, not the work email that they use. They can then set a password, they can put in their phone number, they can put in the credentials, whether it's a biller or it's a manager, you can put in those credentials, correct? And then you just add them as an admin, and then they'll be able to access the system for you. Now, once the setup is done, you then again go to site admin, and then you change your role to become a location administrator. Now, under the location admin, you then go to providers, and then you verify the information under your respective name. So for right now, my name is Maya Collins as a provider. So I'll go to Maya Collins' profile, and I'll be verifying that all the information present there is correct. If anything needs to be changed, I'll be changing that information, where I can then put in my NPI, DEA, and the taxonomy code, which is related to me and not the facility. And after that, I'll also be adding the states and the license numbers to those respective licenses in those states. And then once I've done this setup, I can then also add my education, awards, qualifications, certifications, and memberships if required, and also any insurance information if accepted by me or not. Now, respectively, make sure that any of the license numbers that you add would be without the special characters. That is, that they should not include any dashes or add the rates, since DocVilla does not count them as a character. Okay. Now on the same page, you can then also add the languages that you can communicate in and that you understand as well, and that will be done for your like the basic details of the provider. Now here, you can also add multiple providers for yourself if you're more than one provider facility, where you just click new when you're adding them for the first time. You can choose the designated role for them, whether they're a nurse or they're a prescriber, and then you can put in their information, including the NPI related to them, the DEA, and the credentials. Now, once that is done, the providers or your staff members, they can then log into their account. They can come back to location admin under the providers and then set up their personal information as well if you are the one that does not want to do it for them. Now, apart from this, if you scroll down a little, you'll be able to set the appointment services for your patients. Now, an appointment visit and a telehealth visit is by default what the system already has. So what you can do is you can either choose to hide this both from the patient portal, and then you can create your own appointment service, which it could be a medication pickup service. The description is the patient is just picking up their medicine, XYZ, and then you can put in the time allotted, maybe like 5 minutes, and then you can put in the fees included with it. For example, $1 that I'm just putting for right now. And then I can choose whether it is going to be in a video, of course not, because it is just a pickup. And then I can add another service, which is just a consultation service, right? You can put in a description of your own. You can do the time allotted, let's say 15 minutes. I can put in the fees to be $150, and I can do, if it is a teleconsult, I just select is video. If it is not a teleconsult, I just select nothing and I let it save it. I can also set the color for my appointments if required. Okay. Now, once this is done, you'll be able to manage and add more information. You just hit save and the system will save those changes for you. Okay. Now again, coming down under the additional settings, you'll be able to add a person from your staff as the delegate for yourself, so that they are also able to receive the notifications on your behalf, and they can actually work around the system for you as well. Now, once this is done, you change your role, and then you go to location admin again. You change your role to then become a prescriber. Now, once you're into the prescriber role, you'll be able to set up your calendar. Now, all the things that I'm doing as a prescriber, you can also do it when you're into the location admin role, but I'm just showing you it as under a provider. So as a prescriber, you can click calendar, okay, and then you'll be able to set your availability based for a particular day, week, or month. Now for this, if I'm talking about a week, you just hit add availability. And then for each time of the day, you'll be able to add the time period that you work for, and then also choose the capabilities that you want to be present. Now, for example, I only work in person up till 12 p.m. So I'll just put my time to be in person till 12 p.m. Where is it? Right there. And then can I add another time slot that starts from 1 p.m. and it goes up to be around 8 p.m., which is totally teleconsult. So I'll just deselect the in-person button and I will save those changes for you. So my patients, they will not be able to book me apart from my availability. And then that is also how I can manage the availability based on the capabilities for each day. Now, you can also see your availability on your calendar based on the month. Now, if you want to change the timing or the availability for any particular day, you can just click that day and it will change you to add availability area where you'll be able to manage. And if you're not working for a particular day, you can just select I'm not working on this day and you just hit save and the system will clear out that day for you. Okay. Now, once this is done, you've set up your availability. Now what we're going to see is how can we add a test patient into our system. Now, since it'll be the first time for you to add a patient, you'll be seeing no consults like I do right now at this point. So the calendar would show something like this with your availability, okay? And then to create a test patient, you just go click the Patients tab on the top. You hit add patient, okay? You can put the personal details or you could just say a test patient, okay? You can put in their date of birth as anything. For example, I want to put it to be, let's just select it to be 2003. So I'll just choose it to be January 1st, 2003. And then you can put in a random mobile number. If you want to receive notifications, you can use an actual one as well. You can put in a home phone. You can put in an SSN number if applicable, just like gibberish one. You can choose their birth gender. You can search for any random address, and then the system will pick it out for you. And then you can also put in an email for them so that you are able to see how the patient portal will be enabled for them respectively. And then you just save and close it, and the test patient will be created for you. Now, once you create that test patient, you'll be able to see them on the list here where it will just show as a test patient, okay? Now, in my case, my test patient would be Fiona Adams, okay? So when you are creating the consult, your very first consult for your test patient, all you do is you go over to this little thunder icon under actions. You click it. You then choose the location, which would be the one that you're currently working in. You can then choose the provider. If you're a single provider, it will just show one name in the dropdown. If you're a multiple provider, it will show the list of all of your providers. Then you can just choose them. You can choose the consult. I recommend you choosing a teleconsult one if you are a practice that participates in televideo medicine. Otherwise, you can also do a normal appointment visit as well. Then you just choose the date and then the time, and then you just save it, and the system will create the consult for you. Now, any consults that you have created, they will show up under the consults tab. Okay, so once you go inside the consult and you click the particular appointment that you created for your test patient, you'll then be able to see the session details as the very first view. Now, from the system point of view, there are two types of profiles that open, or the details that open up. So one is that you go to consoles, you open up their encounter, which will show up as encounter details. And you can also see it on the top that it mentions that it is an encounter detail. Now, within the encounter, if you just click or hover up to their name and you click the name, and another window pops up, which would be their patient profile, and you'll be able to see that there's a patient. This is the patient profile for a person. So that is how you can distinguish between an appointment or an encounter and the patient profile. Now, coming back to the encounter, so you'll be able to see the basic details of the patient, correct, including their date of birth, the fees, the type of visit, the reason that they're visiting you, and their miscellaneous other details as well, where you'll also be able to see the demographics, which in real time, the patients, they usually fill in the intake form. But for you to see how the intake form looks or how this fills out, you can just hover up to actions, okay? And you can send yourself, if you are acting as a test patient as well, or the person who is acting as the test patient, you can send them the intake form, for which you click on send patient intake. And then you can choose to send it via SMS or email. Right now, I'm going to send it via email. And once that is done, the system will send them an email that your house MD is requiring additional information. So you open up that email, you click fill information, and then it will take you to a security check where the patient will be asked to put in their date of birth. Now, again, make sure that you enter the date of birth that you set for your test patient, which in my case is January 1st, 2000. So I'm going to put that information, and then I'll be able to access the intake form respectively, where you can fill in this information as much as you want, correct? And then you can also choose any health problems, which is usually unique to your practice, and you give us the list of, the list is actually based on the information that you provided us in the Excel sheet, so that is how we manage this. You can put in a supplement information, any allergies. Yes, I'm allergic to peanuts, so you can put that. And then you just go down and submit the form. So when you come back to the encounter, and you just either refresh your page or you just quickly switch your tabs between patient info session details, and you'll be able to see all those information allocated in the demographics area for you. Okay. So that is how your patient intake form works. Again, this is something that if you want to try out, you can definitely do it with a real email address or a phone number with your test patient. Now, again, what we're going to try out next is the telemedicine. So for that, you again hover up to actions. You click to send an appointment SMS or email to them. Now, once you do that, again, the patients, they will receive an upcoming appointment reminder where they'll also be able to join the consult. So whoever is acting the test patient in your case, you can ask them to join the video consult from here. And then you as a provider, just click over the start video button, and then you start the video consult for them. Now, once you do this, you'll be able to conduct your telemedicine, and we'll be able to prescribe or consult with the patients respectively. Okay. Now, once that is done, you'll also be able to share your screen if you have to at some point, and you can also record the session from here. Now you just hang up, okay? You come back to the encounter to further play around with the system. Now here, you can also see the patient communication, how it is done. So the first way would be that you select the send message to patient portal. You drop down a text to your test patient, and you just send it. And then you ask the person acting as the test patient to log into their respective patient portal and then reply you back to the message. So that is how they'll be able to do that for you. Going further, you can also try sending a text message to their phone number, okay, where you can put in a real phone number for your test patient, and then you can just try sending them a text and they can reply you back, correct? So that is one thing. Coming down under the patient information, you can see the clinical recommendations that you have received from the US task force, okay? So that is one. Under you hover down to insurance on the left hand side, and you'll be able to manage the insurance for the patient. And then you can select this button if the patient has a secondary insurance as well. And then you can ask the test patient to enter any gibberish details for insurance from the patient portal, and they'll be able to do that for you as well. Okay. Now, coming down to vitals and charts. So again, the growth values, which is your height and weight, is automatically fetched from the intake form if you fill that. If not, you can also fill your own. Now you can log in, you can try logging in multiple values for the blood pressure as well, correct? You can maybe try putting in 2 to 3 values, and then each value will come up as a different value, okay? And then these values, they will also reflect into charts. So if you want to see the charts, you just click over to the left hand side and click charts, and you'll be able to see them as well. Now, under the documents is where you can upload documents. You can try uploading documents and even try scanning the QR code and uploading the system. Now, again, you hit upload. You can choose a file from your own device, any random file. You can choose the category of that file. You can even put in a description. Now, I would recommend you try uploading a document both, which is either visible to the patient and one which is not visible to the patient, so that you are able to see the difference, which is basically any file that you upload without selecting this button will not be visible on the patient portal to the patient, respectively. And then if you select this button and save the file, the patient will be able to view that particular document on their end as well through the portal. Okay. Now, apart from that, you hit generate QR code, and then you can try scanning this QR code feature directly from the patient's phone, who's acting as a test patient for you right now, and upload a picture, and then you'll be able to see them here, where you can see a little preview pane for that particular document, correct? You can even fax it to somebody if you have to. You can download it. You can toggle the visibility on the patient portal, and then you can even delete it if you have to at some point. Okay. Now, coming down to labs. So again, if you participate with the labs and you want the labs to integrate with our system, make sure you reach out to the labs, and then the representatives of the particular labs to reach out to us for the integration. And once the integration is done, all you do is you can just hit compose, you send the request for the particular lab, you then search for your test. For example, I'll be searching for a CBC. You can choose the desired test, you can associate a diagnosis if applicable, and you save it. Otherwise, I can also create lab groups. Now, how I can create lab groups is very simple. You'll just go under setup, you'll go to ENC setup. Now, once you're into the ENC setup area, you just click labs, okay? And you'll be able to see a lab group and a flow sheet section here. So you hover down to lab groups, and then you select to add a new group. For example, I'll be naming my group as urgent care. Okay, and I save it. Now you'll see that thing or the name pop up on the left hand side. So you select it from the menu, and then you add a new test. So I'm gonna add a TSH. Okay. I'm gonna add another test for diabetes. Okay. I'm gonna add another test for hemoglobin. Oops, sorry, I added the wrong one, but that's fine. So you can add as many tests as you want under the group, and then once that is done, you can come back, you can refresh your page again, and then you'll be able to view the lab groups here, where you can just select the lab group, you save it, and all the tests will be allocated to the patient. Okay. Now again, once this is done, you just send the orders and then they will all show up under the labs icon or the labs tab on the black bar on the top. And you can even see those particular test details as pending with all the patient information, the sent date, the reported time or date. And once you receive the results, you'll be able to view them as well, which I am showing you as an example as I have the raw data, but you will not be able to do that until a real patient consult is created and a real test is sent out. But this is how the results will come back, and they'll be automatically mapped to your patient charts after the integration as well. Okay. Now, coming down to diagnosis, so will be your note-taking area, where for each note-taking section, you'll have your own templates. So what you can do is, once you click on this drop-down, you'll be able to see all the templates in the system. You can search for your desired template. For example, a psych practice can search for the psych templates, and OBGYN could search for OBGYN, pediatrics will search for pediatrics, and so on respectively. You can do that. You can try using a simple template. You can try filling the information. I'm just filling any gibberish data for now so that I can show you how it auto populates. You generate and it will be allocated as notes for you. Now, MA notes, if you want to copy the details from the intake form, all you're going to do is you can click copy from encounter details, and it will copy all the details from the intake form that was filled by the patient for you. Okay. Now, again, these templates, you can also create your own, which I'll show you when I come to the setup section. But for each section, you can then try working around. Now, coming down to screening questionnaires. So for this, if you are a practice that participates or uses the screening questionnaires, you can try filling the information based on the data given by the patient to you. Okay, and then you just save it, and you'll be able to see a score and an interpretation for the same. Now, again, to check and to see how the patients will receive these forms, you just hover to the send area. You select the forms, and then you can send them via SMS or email to the patient. And again, once that is done, the patients will receive a new email that an additional information is required by your house MD. And then you can again follow the prompted steps as required. And once you fill it, you'll be able to see a new information or the information that was filled by the patient initially in the same area. And any forms filled out will have their own trends, which you can also follow up in the trends section. So try working around with those forms, playing around with the forms as well. Coming down to ATOD. Now, ATOD is your alcohol, tobacco, and other drugs. For this, very self-explanatory. You just choose, you put in your additional information in the areas, and then you save it, and you can also try saving it to the patient records as well. Okay. Now, coming to ROS, we'll again have multiple templates that you can use. Just click any of the templates, try filling the information, and then just try generating it, and you'll see the notes auto-populate here as well. Again, social history will have its own template as well, where you can fill this data. You can fill the template if you want. You generate it, and you'll see the information building up here. Now, coming down to allergies, very important. Now, all the allergies that the patient fills in the intake form do not automatically populate into the charts. You'll have to manually search for the allergy and put it into the system. So for that, you just search for the allergy, okay? You'll choose the level, whether it is unspecified, mild, moderate, severe. You can put in a comment and then save the allergy, and the system will save that allergy for you, okay? Now again, make sure that you're entering the allergies correctly. Otherwise, the system will not automatically auto-populate them from the intake form. Coming down to physical exam. So again, the physical exam will have its own set of templates that you can go through. You can search for your desired template for your relevant practice or domain. You can put in the information, any gibberish information that you want, okay, into the templates, and then you can just see them auto-populate here. Now for the diagnosis, this is where you can try entering your ICD codes, where you can also copy from a past medical history, which will not be applicable right now because that will be the very first consult for you of the test patient. So you can skip that for now. You can try adding a diagnosis code from the database that we have, where you can either search for the problem or you can enter the code if you remember that by heart or no. Otherwise, the favorite ICDs that you gave us during the setup of our Excel sheet, you'll be able to access them here, where you just click this little heart icon, and then you'll be able to access your favorite ICDs as well. Okay, so you can try entering those as well into the system. So just for now, I'm going to add an ICD code so that we can actually see how the prescriptions work. So I'm just going to put a tuberculosis for thyroid gland. Okay. Now coming down to inventory. So if you're a practice that keeps any medical supplies, any items, any inventory at your clinic, this is where you can dispense them. Where you can just click the card for that particular item or supply. You can enter the quantity that you're dispensing and you just save it. And the system will update the available quantity, and it will also show the dispensed in the history section. Now again, to set up the inventory and to add stock into your inventory, we'll have to set up a different call, a different session for this, where we can actually help you guide through the inventory setup. So please connect with us on our support email and we'll be able to escalate the steps further. Now coming down to anatomy, so here is where you can mark any area into a human's body, whether male or female, for any things, like for example, injections or vaccines given, rashes, or maybe procedure done. So you can pull that information, you can save it, and the system will save that information into your charts. Okay. Again, coming down to soap, if you want, you can type your own soap notes. You can also use the templates again. This is where you'll find all the templates that we have available for the practices. You can search for your own templates as well, relevant to your domain, your practice. And then you can maybe try using them for yourself, where you can put your own information in each area. You can try entering any random details. You generate it, and the system will allocate it in each section for you. Now here you can also try copying the information from the previous note-taking areas, and that is just that you hover over to the copy from button. You click it and you select the areas that you want to populate into your soap notes. So for example, at this moment, I just want the HPI PP to auto-populate. I do not want anything else. And the allergies, so I'll just select those two, I'll generate it. And if you see, scroll down to the bottom in your subjective area, you'll see those allocating automatically. Okay. So try doing this, try playing around with your note-taking area. If there's anything that you have questions about, concerns about, or something that you're not able to figure out, you can just contact us on our support and we'll be able to assist you accordingly. Now, talking about your prescriptions, which is your ERX area. Now, your prescriptions should be by default active. In case they're not active or you're not able to prescribe, please do let us know, and then we'll be able to assist you with that. Now, apart from this, if you're a practice that has opted for the controlled substances setup prescriptions as well, uh, we'll have to do that setup on a separate call. Please connect with us and then we'll be able to escalate the steps further. Now, once you click send RX, you can then come to compose RX and then you can try composing your prescriptions where you'll have your general prescriptions. You can try creating your own drug sets as well. Okay. And then you can try creating your compounding drugs and then also try selecting the pharmacies as well for your desired patient. Okay. Now, coming down to supplements, so this is where you can connect your full script account and then you'll be able to send and prescribe supplements. Where again, once you create your account, you'll have to let them know that you're using DocVilla as your EMR so that they can bidirectionally integrate with us. There's no additional cost, it is included in the package, but we do recommend you to create your account and connect it to your DocVilla account as well. Now coming down to check eligibility, so this is where you can check the eligibility if you're opting for insurance and this feature for your patient, where you can just, now this I would recommend not doing for the test patient since you'll not have an actual insurance detail, but maybe for your very first actual patient, you can put the insurance information and try running the eligibility checks where you'll be able to see all the information about their coverage, deductibles, limitations as well. Now, for the patient charge, this is your billing area where you can try entering the amount and then you can see how everything works. Again, please do not put any of your real credit card details when you're working around or playing around with the test patient in the system, otherwise you'll be actually charged. So you can do a cash checkout if required. You can just put in $100 as the charge, and then you can do a cash checkout. Okay, and then you'll be able to see the recorded information for the past payments. Okay, and then you can also post any outstanding charges if applicable, and then you can put in the notes as well. Okay. Now, submitting the claim. So this is a pre-populated CMS 1500 form. Again, for insurance, we'll be setting up a different call with our insurance team if you are opting for the insurance option and billing through us. So please contact us or email us back at support and we'll be able to do that for you. Now, under the actions, you have multiple functionalities that you can play around with. Where you can also print forms like the detailed summary for your encounter, the super bill, the expenses summary, or patient verification. Okay. You can also try creating a follow-up for the encounter. You can sign off. You can see the past appointments. You can also see the audit logs if required. Then you can also work around with the other drop downs if you have to or if you want to. So that is what all you can do for now under the consult with your test patient. I recommend you playing around with the system, playing around with the consoles, try creating multiple consoles for your test patient so that you can also see how the information is actually carried forward and how can you import it into your following consoles. Now, just to give you an overview of what the black bar on the top holds. So your consoles, all your appointments will show up under the consoles, okay? Claims, if applicable to your practice, they'll show up under the claims tab where you'll be able to access the claims that you submit. Any ERAs you'll receive under the ERA tab. The inventory setup will be a separate call, so I will skip that for now. Under the fax, if you have opted for the fax feature, this is where you'll be able to manage, receive fax, and even send them. So when you receive the fax, you'll then be able to preview it again, okay? And then you can associate to a patient or a patient encounter. Now for this, you just search for the patient's name. Again, it pulls up the information with the encounters where you can choose the encounter that you want to associate it to. You can choose the document type, for example, an X-ray. You can name the file that chest x-ray. You can put in a description, x-ray done on March 25th, 2026, and you can save it, and the system will save it in that particular encounter. Okay, but if it is for a profile, again, you just search for the patient, you select the document type, you select the file, and it will save that for you. Okay, now for the referrals, we participate with directpress.org, so you can try sending and receiving referrals if required to other providers and clinics as well. And if there's something that is not working around with the referrals, or it is something that is not set up for you, you can reach out to us and we'll be able to assist you on this. Now, all the patients that you create or you have added will show up here. So if you're looking for a particular patient, you can just search for their name by entering them, and then you'll be able to look at that details as well. Now, the labs will be under your lab section. The messages will have your conversation, whether on text to the patient's phone number or to the patient portal. So the phone number text messages would be under the SMS tab, where you'll be able to see the messages and who did those. And then the in-app messages would be your patient portal messages that you're sending to the patient, where you can also click staff and you can try messaging any of your staff members as well. For example, the house biller. Hey, house biller, I want you to clear out the claims for you. I want to submit the claims, and then they'll be able to submit those for you. Okay. Now, again, the calendar is your setup for your availability. You can change at any time of the day, week, or month, however you would please. And then any setups or customizations is under setup, and then you go to ENC setup. Okay. Now, under the ENC setup, you'll be able to create custom templates for your SOAP, review of systems, social history, other templates, CCHPI, physical exam. Okay, so you can create those templates. Now, after this, for your consent forms, we do have the available ones pre-built by DocVilla in the system, but if you want to create your own, you can create them using the Adobe Form Maker and then upload the PDF version of those forms to the system, and then you'll be able to send to the patients. Now, for that, if you want to send any custom forms to your patients, you just click the Patients tab. You go to that patient's profile, we'll just search for them, and you click their name, and it takes you to the patient profile, where under the forms, you just hover down to forms, and then you'll be able to send the forms to the patients. Where, for example, if you want to test out, you can just send a test HIPAA form to your patient via SMS or email, and then they'll be able to fill that out for you as well. So that is it. I would recommend you to try playing around with the system, with all the consoles, your test patient, and if there's anything that you're not able to understand or work around with, feel free to contact us on our support email, and then we'll be able to assist you accordingly. Thank you so much. Bye-bye.